We're talking about the level of tax that will actually be falling on people. People on very middling incomes being asked to pay up hundreds of pounds more every year. Is this an acceptable levy to fall on people of working age?
Well, I'm deeply concerned about it, because we know that the value of people's wages have not kept pace in recent years, and I think, Frank, the Tory party never again can claim to be the party of low taxation. And of course, Boris Johnson and all his Tory MPs in here went to the general election and promised their constituents that they wouldn't raise national insurance. And he's just broken that promise. And I think if you're a midwife or a nurse or a paramedic or a care worker, you're going to be paying more tax as a result of these proposals. And if you're a care worker, there's no guarantee you're going to be getting a wage increase. In fact, you're going to be paying more to go to work to do your job. So I think it's a very unfair announcement in that respect.
The Prime Minister hit back at Keir Starmer today, saying that Labour doesn't have a plan. What would be Labour's response? And he's right, isn't it? The Prime Minister's put forward a plan. It might be a plan that you disagree with, but at least it's a plan. What would Labour's response to that be?
Well, of course, we're commenting on the government's plans today, and that is the responsibility of the opposition to comment on what the government put forward. The problem with Boris Johnson's plan is that he's saying it will cap care costs, but because there is often a discrepancy between what you pay as the individual towards your personal care and what your local council is prepared to pay, and the local council often pays less, it's likely, unless he's going to iron it out, that you'll be forced to pay more than the £86,000. There'll be top-up charges on top of that, unless he's got a plan to iron that out, and I didn't hear that today. In terms of what the Labour Party would do, well, we've always said you need a system which gives people as much support to stay at home. You should have a right to stay at home and receive care at home. That's the first principle that we would put in place. The second principle is that you've got to have a properly funded system, so local authorities are not paying people such low wages, and the staff are all on zero hours contracts. And over the coming months, we will be detailing more on this, on our alternatives. But of course, look, we've got to fix this. We've got to fix social care, and we've got to do it in a fair way. And we would work with Boris Johnson, because my word, he's got a massive problem in there. The Tory MPs are not happy. You've got a very frosty reception. He knows his Tory MPs don't want to put up national insurance. We don't want to put up national insurance. There's got to be a better way of doing this.
So there are other taxes that you would want to rise. I heard that Keir Starmer was saying that he would think about raising taxes on shares, potentially. Is that something that you're looking at?
Well, assets, wealth, stocks and shares, these are things that we would want to consider. You could look, for example, at really... What we're saying to the Prime Minister is, look, we know your own Tory MPs don't want to increase national insurance because they promised not to increase it. We don't want to increase national insurance because we don't think it's fair on the low-paid care or a low-paid nurse. So why don't we sit down and see if we can come up with a fairer system to fund social care?
Is it fair that we're all talking about ways by which the taxpayer could help protect the assets of people who are older and have quite sizable assets in terms of monetary value? Is it the role of the state to help to make sure that someone can keep an enormous amount of wealth that they have built up over time and in order to receive free social care?
I think the way I look at it is, if you or I are looking to get cancer, the National Health Service will step in, will provide our medical care, and will look after us. If you or I are unlucky enough to develop dementia, it's treated in a different way, and that is a lottery. So that's the roulette of life, and I don't think that is fair. So it's why we do need to fix this. But the proposal that Boris Johnson has put on the table today is that he's increasing national insurance for my constituents, for the constituents in Mansfield, constituents in Rotherham, constituents in Derby. He's putting up their tax, yet it's a proposal which will benefit the people in Surrey and Sussex and Hampshire and Berkshire proportionately. I don't think that's fair.
And just finally, do you think that the Prime Minister's stolen a bit of the Labour Party's colours today? That this is a pretty left-wing Conservative party looking at recent governments?
Well, that's certainly what a lot of Tory MPs think. I mean, you've got Tory MPs in here who've been forced to lock down their constituents, who are now going to be introducing vaccine passports, a form of ID, and now they're putting up tax. So I know there's lots of Tory MPs in here who think, my word, what have we got here with Boris Johnson? He's not a Tory, is he? Is he a big leftie in disguise? But I don't.
Is this the Shadow Health Secretary endorsing the Conservative Party government?
But I I don't actually believe that, because you've got this is a government which is about to cut universal credit. It's going to put so many children into poverty. This is a government that's cut billions from social care over many years. So I still think this is a very regressive, reactionary government. I don't remotely think this is a government stealing the Labour Party's clothes on this. But there are certainly lots of Tory MPs who are fed up today.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.